On occupational hazards among agriculture. It is very important to know because India is a country with 80% of the population. India or mainly depend on agriculture. So commonly among agriculture workers, we see the following health problem. Zoonotic diseases like brucellosis, anthrax, leptospirosis, and tetanus, tuberculosis, and Q fever. These are all the zoonotic disease seen among agriculture workers, and accidents mainly due to machine and insect bite and snake bite and vermin. These are all the accident can be seen due to agriculture workers while cut, cutting machines. Due to cutting machine, tractors we've been used in agriculture. Because of this, they may get accidents or snake bite or insect bite or the other things. And toxic hazard due to inhalation of fertilizer, insecticides, and pesticides has been seen by accidental inhalation, or sometimes people may use for suicide. Also, this is also one of the health problems seen in agriculture due to these chemicals. Then physical hazards because they're working in the field, their exposure to sunlight and solar radiation is very high, and if they are working in a sunlight, the heavy temperature, they more prone to dehydration, sunstroke, sunburn. These are all the problem due to humidity. Even they go for severe dehydration. Then respiratory problems, which is seen in agriculture mainly because of the dust grains and the A grains will may cause A fever. It is also been called farmer's lung disease. Already have been discussed like bacinosis, pegossosis, exposure to cotton dust. Okay, even they more prone to asthma. Sugarcane dust and cotton dust also produces bacinosis and begossosis, and farmer's lung due to A grain. This all been I discussed earlier. You all know. Yeah. Sickness absenteeism. Sickness is one of the most common cause for absence, and it also one of the index which tells about the industry's health problem. If more sickness is being noticed in a particular industry, means they are not providing good care for the people. Usually, the incidence of sickness absence is seen about 15 to 20% of the workers, and about 8 to 10 days in a year. The commonly noticed cause for sickness absenteeism is economic cause. If they are providing less money for the workers in particular industries where they put the sickness leave and they go and work for in the other day in other industry, or they do some other job so that they can earn more money. That is the economic cause. And social cause, we all know India is a country with lot of festivals. They can't take leave for every festival, so they give sickness is one of the cause. And wedding, marriages, and some of the uh, ancestral house functions. These are all the social causes, and some of the people they go back to their villages for jatra, melas, all those things. That is also one of the social problem which is being noticed due to sickness, cause for sickness, absenteeism. Then medical cause. Medical cause mainly like respiratory diseases or gastrointestinal problems like diarrhea also been one of the important cause for sickness absenteeism. That will be the true cause. Then non-occupational causes for sickness absenteeism is most commonly in India is noticed is alcoholism and drug addiction along with nutritional disorder. How do you prevent this sickness leave? By good factory management and practice, by giving encouraging the people and paying adequate amount of salary to the workers, and give for the leave for the festivals which are celebrated in that area. Very commonly for those festivals should be given holiday, so that the sickness absenteeism can be reduced. By this has to be taken care by factory management. Then adequate pre-placement examination of the health worker before making them to join in particular job, and good human relationship between the employees and the owner, that is plays very important role, so that people work for their owner if they have good relations. And application of principle ergonomics, you all know ergonomic means fitting a right job to right person. Then comes health problem due to industrialization. Industrialization is one of the important cause for the change in the economic and cultural of the nation. So this revolution of industrialization changed the whole economic and culture and social behavior of the people who are coming from rural area to urban area to work in different factories. So this will lead to some of the environmental sanitation problems like housing. Housing is the biggest problem. People who come from rural area, they are the one they created slums and dwellings which are unfit for living. Those in because they living in those area because they have to pay less rent and they can easily uh, stay in this. And water pollution mainly because of the industrial waste and chemicals which are produced by the industries, like without proper treatment they have been directly released into rivers and seas, like acids, alkali, oils, toxics, synthetic detergent, radioactive substances. And air pollution is also one of the cause for air pollution is in nowadays because of rapid development of industries. So these industries which discharge, or factories will discharge toxic fumes and gases and smokes and dust in directly into atmosphere without having a proper planning before living into the atmosphere. And improper sewage disposal due to insanitary way of disposing the waste due to improper housing or creation of slums, that all lead to improper sewage disposal, which leads to so many waterborne diseases and mosquito water related diseases like typhoid, paratyphoid, even mosquito borne diseases. All these are all the communicable diseases which are being due to improper sanitations. Also the communicable diseases mainly because of this improper water, air and sewage disposal. Mainly the other communicable diseases which likely to see in industrialization is tuberculosis and venereal diseases. These are all the important communicable disease seen. Sexually transmitted diseases also seen because people who are migrant workers who leave their place and they come here and they first their sexual satisfaction they go for prostitution, so that the increase in venereal disease also been as noticed due to industrialization. Then food sanitation, foodborne infection has been increased because people were working people, they start eating from outside and insanitary made food because of it is available in less price also, so that which leads to foodborne diseases like typhoid, viral hepatitis, etc. Then mental health problem has been noticed in industrialization Due to industrialization, mental health problem has been increased. Why people from village will directly come to work in a town area where industries are more, they get a lot of job, but when they come from village area to city, there will be adjustment problem and behavioral disorder and juvenile delinquency. This all been increased due to mental. Then accidents is one of the health problem of the industrial area due to congestion, way traffic, increase in the tempo of the life. The in Along with the accidents which are caused in the industry, the road traffic accidents also been increased. Then social problems. The social problems which is increased due to industrialization is alcoholism, drug addiction, gambling, prostitution, increase in the diverse, uh, then juvenile delinquency, higher incidence of crime also been noticed, and morbidity and mortality. So, when you come to vital statistics in industrial area, the high morbidity and mortality is noticed maybe because of the increase in the incidence of chronic bronchitis, lung cancer, when higher in industrial area when you compare to rural area or village. Then what are the measures we have to take to protect the health of the worker who are working in the industry? First, foremost is nutrition. You should have a canteen for workers if it is 250 or more. All staff should be given a food at reasonable rate, mainly during the lunch hours in the afternoon, and they should be also taken care of their, if they have any communicable diseases during this time when they join with a new job. The communicable disease from rural area to urban area, the chance of getting communicable diseases are very high. For example, the people who are working in a bigger industries and they have been paid less, they more prone to eat outside. Uh, this will lead to typhoid, viral hepatitis, amoebiasis, and fever, intestinal infections, and venereal diseases, even malaria uh, and tuberculosis. So that this can be easily prevented by taking care of their health and providing a sanitary measures uh, and good health education to their workers. Then environmental sanitation is plays very important role. They should be all the workers should be provided a good water supply for safe drinking water, both in the working area and where they stay, or in their or near their house also. And food is most important and should be sold in a sanitary measure. They are not allowed to uh, eat in outside where it is selling in less price or roadside. Food should be provided in the factory only, and that will help to prevent foodborne infection. And toilet should be provided for 25 workers, for separate for male and females, and thereafter for every 50 workers should increase the toilet facility as the people in the working area increases. And general cleanliness is very important, like cleaning of the floor, roof every day, it is very important. And sufficient space between the each worker should be there. For example, 500 cubic feet per worker should be there. That should be sufficient. And good adequate lighting and ventilation should be there. If lighting is inadequate, it leads to accident. Even ventilation is inadequate, it leads to respiratory borne diseases. And protection against hazard should be given to the people, workers. Mainly adequate environmental control should be designed so that protection against dust, fumes, and other toxic substances should be given. And good housing. There should be provided a good housing in the industrial area. They are not allowed to create a slums, which in turn lead to so many insanitary problems. This is about and mental health also very important. Should play important physical health is not only the mental health and psychological stability is also very important. Love, recognition of their good work and their skill should be encouraged. That is also be done. And health education to be given to all the workers regarding their cleanliness, personal use of personal protective measures, and personal hygiene. And family planning should be done to all the workers about family planning. We should not have more children so that they can't give good education. All those things has to be told. A measure for women and children should be done. Maternity leave should be given at least 12 weeks, and provision for antenatal, postnatal, and natal services for all the women who are working in the particular factory. And no woman should be given at work in the night between 7 p.m. to 6 a.m. And our women should and children should not be allowed to working in any mines. And women who are working in women in particular factory, if it is working more than 30 women are working, one crate should be provided for those people. These are all the measures to be taken uh, during to protect the health of the workers in the particular factory. So I'll be completing part 2 of the occupational health. Thank you. I'll be taking the next part 3 in the next week. Thank you. So stay home, be safe at home. Don't come roam around. We all know that there is a epidemic of corona is going on. Thank you, one and all.